Good evening, everyone. Welcome to My Avi Fences and the European Fertility Society. We are back with another webinar and another interesting topic. As you can see, our special guest is with us already. Dr. Halina Strelko is right here to support you, to answer your questions, and also discuss and explain embryo donation. This is our topic today, and Dr. Halina is definitely going to explain all those little bits about this. And remember, we will start with Dr. Halina's presentation, and afterwards there will be time for your questions. As always, remember to put those in the chat so that Dr. Strelko can help you with any questions that you have. I know those kinds of topics regarding embryo donation bring lots of questions. So don't hesitate. We are right here for you as always. And obviously, we are glad that you were able to join us today. As you know, we are here almost every single week just to answer your questions, but also to educate, give you some tips, and also give you a chance to ask your questions to the top fertility experts as Dr. Halina Strelko. And let me just remind everyone that Dr. Halina is a founder of IVMed, which is located in Kiev, Ukraine. I'm glad that you're back. Lovely to have you back as always. How are you feeling? Hope all is okay. And you are ready to give us some tips on embryo donation as well.
Yeah, sure. Good evening. I'm really happy to be with you today. It is probably 2-3 months from the
True.
last meeting, so it's quite big time
True.
passed.
Usually we have webinars a little bit, because last time we had an embryologist from IVMed, sorry,
Yeah, from
but
our clinic as well.
exactly. But today you are the one who will be supporting us. So thanks a lot. Let's get going with our topic. This is going to be interesting, I'm sure. So let's begin. Okay.
Yeah, thank you,
Thank
thank
you.
you. And today we will talking about embryo donation. This topic seems to be simple, but now when I have patients in consultation, always there are a lot of questions. So today I will try to answer the more typical questions, and there are some interesting points regarding NGS testing and so on. So, what are the advances of embryo donation and when is it indicated? First of all, I would like to show you that when we are talking about egg donation or embryo donation, we should thinking about how many parts are involved in this process. Donor of sperm, donor of egg, couple, recipients, offsprings, also necessary to have in mind that offsprings theoretically may have half brothers and sisters. Also, maybe a lot of psychological and ethical questions in this process. So it is not so easy, all that. And when we are talking about embryo donation, necessary to see the first of all legislation in different countries about egg and embryo donation, because in some countries it is quite easy to do, in some countries it is totally prohibited. Also, when you discuss this topic with your doctor, necessary to understand the source of donors' embryos. It may be donors' eggs and donors' sperm, but it may be also what we call embryo adoption, and it is a little bit different. Also important to know how donors should be investigated from medical point of view, and success rate depends on that as well. Also, very important is preparation protocol, and we will see why. So, if you will see on this slide, you can see that most of country practicing egg donation. Only few countries in Africa and Asia not practicing, but most of European and US countries and South and North America countries are practicing egg donation. Um, in this slide, it's very little, but after you can probably be able to see that in bigger version, because this lecture will will be available in records. So you can see what is the legislation of different countries regarding sperm donation, egg donation for single woman, single man, for hetero sexual couple, for homosexual couples. And you can see that most of these RT techniques are available in most of countries for heterosexual couples, but mostly impossible to do that for homosexual couples to men, because only few options like surrogacy, and in most of countries for such couples it's impossible. And for single woman, also in some countries may be restrictions about embryo donations. You can see that about egg donation and sperm donation, mostly 80%, 85% perform. And about de novo embryo donation, I mean embryo creation, especially for embryo donation, not a lot of country, around 24, 25, 30%. But we can see that the number of embryo donations, the trend in embryo donations, is constant increasing in number of these procedures all over the world. So anyway, Anyway, in most countries, oocyte donations and embryo donations are authorized and performed by heterosexual couples. Single women can also obtain donated oocytes, donated sperm, and donated embryo in most of countries. For homosexual male pairs, have really very limited possibilities. And most of countries done embryo donation as embryo adoption. It means that there are existing embryo and a couple who has done the IVF program has now all children who they would like to have, and finally they accept that this embryo, super embryo that they has, can be given to another couple. Here you can see another important question of age limitations. In most of country, woman's age for IRT treatment is taken into account, and in most of country it is 50 years old. In some country it may be 51, 52 years old, but in most of country this is the limit, age limit. And also necessary to know that there are no age restriction for men. Only few countries give this restriction around 60 years old. Also, important to know that there is a age restriction for donors. For male donors, in most of countries, it is 40, 45 years old, and for sites, it's around 35 years old. And only few country asking proven fertility. It means donor of eggs should have, or donor of sperm should have as minimum one child. It is in Ukraine like that. And also there is a limitation of number of children born from each donor. So it's important to know and asking about this legislation, because it is possible to use some donors' embryos and discover in 20 years that, for example, your children may have 10 or 15 half brothers and sisters. So it's important to asking about that. Um, So, before embarking on donation program, you need to be well informed about the legal framework in the country where the donation will take place. Also, make sure that at the time of transfer, the age, patient's age, your age, does not exceed the age restriction in that country, because maybe unfortunately that you come prepared for the transfer and it will not be possible. Also, you need to be aware of the type of embryo donation involved, and tests which was done for these embryos. So, as we have said that patients should consider the possibility of multiple genetic half-sibling when choosing a donor, and that exact form of donation. A very important guideline was done by ISRM, American Association of Reproductive Medicine. These guidelines describe the rules of gamete donation. It is described exactly which kind of exams should be done, also which kind of consents should be done, about psychological examination, and so on. So it's important to know that these guidelines are exist, and if you would like to see, you can find in internet. So what are the indication for donor sperm insemination, for sperm donation? Because embryo donation, it is sperm donation plus egg donation. So when we can talking about sperm donation, so male partner with azoospermia or severe oligozoospermia or other significant sperm or seminal fluid abnormalities. Maybe also some ejaculatory dysfunction. Also maybe situation when couple has done several time IVF attempt and there was no fertilization with intracytoplasmatic sperm injection. It's quite rare condition, maybe I don't know, less than 1%, but sometime it may happen. Also, maybe some significant genetic defects, so we can transfer this genetic defect to future baby. Also, in some case, maybe rhesus negative female with severe rhesus isoimmunity, and female without male partner. All these indications are written in this guideline, and you can find them if you would like to see more exactly. Indications for use donors oocytes. woman who has ovarian failure, medically talking hypergonadotrophic hypogonadism, it means that low level of estrogens and progesterones and high level of FSH and LH. It means menopause. Women of advanced reproductive age, mostly if we have age more than 43, 44 years old, unfortunately the quality of eggs is not so good, and in most of case necessary to thinking about egg donation. Also low egg quality, also some genetic problem as well, and in case of two-man couple and surrogacy. So, what is the difference of two type of donor embryos? For example, if we use for embryo donation donor oocyte and donor sperm, in this case, the benefit is that we have standard donors examination. Normally, in most of countries and most of clinics, this standard donors examination include much more points than standard patients examinations. For example, psychological assessment, some psychological metric tests, some infections. Quite often, clinics doing carrier genetic screening test for donors. So it is really maybe helpful in case on donor egg using. Also, more deep profile information about egg donor or sperm donor. Psychological profile, in most of case, also available. Also possible to asking about additional genetic or infection tests. But negative point that mostly this kind of treatment will be higher price if clinic create embryos from donor eggs and donor sperm, especially for couple. Price will be higher than price of what we call adopted embryos. Embryos remaining after completion of the IRT program, unfortunately, in most of cases, we will have less information. I mean, profile, because patients normally does not feel such enquetes as donor doing. They will have standard ART examinations. In most of case, without genetic carrier screening tests. But from the other hand, this embryo will has what we call proven fertility, because in most of case patients give their embryo for embryo donation after delivery as minimum one healthy child. And also positive that price will be normally twice lower than for previous option. Um, Psychological assessment. Why it is important? Because egg donation is highly emotional experience for both donor and recipient, and reliable oocyte donor programs include psychological examination of all people, all both part involving in this process, and assessment of donors' mental health, also very important to guarantee the health of future children. When we are doing this psychological examination to our donors, we can see that we try to find and screen potential instability or psychopathology, and around 10% of potential donors we discover such problem, and in this case we don't continue to working with them. Also, maybe some specific psychological problems in communication. And in this case, donors need more attention and some specific approach. Also, we try to understand if donor do that, how to say, not understanding well what he's doing, or maybe somebody from family push them. We don't found such person, but it may be, and profound psychological examination help us to discover that. Also, assessment of awareness of decision. It's important that all these decisions should be taken really openly, and people should understand what they are doing. Uh, so, legal requirement for donors. For example, in Ukraine, legal requirements for donors are not very complicated. Only one difficult, if we can say, request is proven fertility. Egg donor should have as minimum one healthy child. For sperm donor, it is the same. Another country has different requirements. It's a requirement, for example, from HFA. It's UK. This is mostly describes exams and term of these exams which we should do in. So it's important to asking when you are starting this program what exactly and when and what are the terms of these exams when you will do your egg or embryo donation program. So very often patients asking about genetic testing of embryos in embryo donation program or egg donation program. So we should talking about that, because previously, 5 years ago, 10 years ago, it was like must have genetic testing on embryos, but last publications show that probably it is not like that. We should say that genetic testing increased the cost of the program. From the other hand, it may exclude disease such Down syndrome and probably diminish the probability of miscarriages. But is it really improve the pregnancy rate? We will see. So the publication of 2020, quite recent, very interesting scientific work. They take one egg donor and divide 12 oocyte into group, if we can say. Control group without PGTA, without genetic testing, and study group with PGTA. It means that all sites provide from the same donor, but one half tested, one half not tested. And try to see the following parameters, like percentage of aneuploid embryos, frequency of pregnancy, frequency of live births, cumulative frequency of pregnancy and live births, and miscarriage rate. And the result of this study, you can see here that the median aneuploidy rate per recipient was around 25%. So it's not very high. Around 43% of cycle, mostly one half, had only euploid embryo. It means that all embryo was okay. And 12% of cycles has no euploid embryos, but necessary to say that 6 eggs is not a lot. Normally, in most of clinics, for 6 eggs, embryological laboratory guarantee 1 or 2 embryo, no more. So from 1 or 2 embryo, no one euploid embryo, it may be by by chance. If we discuss about 12 embryos or 10 embryos, probably these numbers will be different. And the most interesting that with tested embryos and with embryos without PGD diagnostic, we have the same pregnancy rate and we have exactly the same live birth rate. In this graph in blue, it is the first transfer tested embryos and not tested. Then you can see that it is exactly the same. Only little difference was seen with miscarriages. Couple of percents higher miscarriage rate with embryos without PGD diagnostic. So the idea of this study that probably with egg donation and embryo donation, there is no real benefit from pre-implantation genetic testing for aneuploidy. And PGTA did not improve the likelihood of live birth for recipient of donor oocyte, but it may avoid miscarriage, diminish as minimum, and avoid embryo transfer in cycle with no euploid embryo. Only this benefit. In case on embryo adoption, it is not the same situation because normally age of patients is higher, and the patients who leave their embryo for embryo adoptions normally basically has their own fertility problem. So in this case, probably the choice of genetically tested embryos will be more reasonable. So, if we are talking about embryo adoption, it is important to asking about exact age of both partners, because we know that after 38, 39 years old, the probability to have genetically problem in embryos is much higher. Also, will be important to asking about the indications for IRT program of these patients, because one thinks if it is, for example, fallopian tube obstruction, and another if this couple has previously multiple miscarriage of pregnancy. Also, the exact number and type of investigations that were carried out, NGS, if it was done, and results of their treatment, if it is possible to know, for example. When we decide to do embryo donation, the second more often question is about embryo quality. And it is really important because probability of implantation depends on embryo quality. In this picture, you can see blastocysts type A, B, and C. There is a classification of Gardner. This classification describes the cells of future placenta, trophectoderma, future embryo, and the size. So when you have embryo described as A55, or 5AA, it means that it's very nice blastocyst, big with good quality of cells. And if you have, for example, 4BC, it means that the quality of cells of embryo is not so good, and probability of implantation also not so good. So you can see in this scientific publication that it was compared different type of blastocysts and probability of pregnancy and delivery. For example, from excellent blastocyst to embryo, what we call morula, mean previous stage. And we can see that probability of pregnancy directly related to embryo quality. It means that when we discuss in the embryo donation or egg donation, it is important to know what is the exact description of embryo quality, what is the exact grade of this embryo. Um, The probability of embryo implantation depends directly on morphology, and it is correlated with genetic composition. It is not the same. Sometimes we have very nice embryos with poor genetic and recto verso. But in most of case, nice, excellent, morphologically good embryo will have better or normal genetic. Also, very often patients are worried about cryopreservation. I should say that now most of transfers in our clinic, and this is the tendency all over the world, is doing in cryocycles. And embryo donation in most of cases will be done in cryocycle. So most of this cryopreservation is done now by vitrification method. It is very quick freezing, very quick decreasing of temperature, and this method not give ice crystals. And with vitrification method, the probability of thawing normally up to 95%. In this slide, you can see that number of freezing embryo transfer constantly increase all over the world, and it is mostly because the very good results. And in case on ovarian stimulation, if we have more than 7, 10 follicles, we will have better results with cryo transfer than with fresh transfer. And in this slide, you can see that in around 2010, 2013, the number of cryo transfers exceed the number of fresh transfer. And it is confirmed that it is safe and very successful. But patients are worried about impact of cryopreservation, and is it maybe some influence of unborn child, or probably on embryo quality. And it's true that there are some publications about possible negative influence of cryopreservation, because this process may increase the number of free radicals and increase apoptosis, and may influence some genetic DNA. And all these influence are described. And even there are some publications about the probability of negative influence of cryopreservation on pregnancy rate, but sincerely speaking, I found only one publication about that, and more recent publications and big meta-analysis does not show such influence. For example, last publications 2023 with very big number of participants show that there is no significant difference in the pregnancy outcome, including biochemical pregnancy rate, implantation pregnancy rate, clinical pregnancy rate, ongoing pregnancy rate, and live birth rate. when try to compare different time of cryopreservation. Short time with very long time, but even when was study long time cryopreserved embryo, like 7 years, 10 years, there was no clinically significant difference in terms of pregnancy rate. Uh, when in the same study was seen the difference of preterm birth, for example, birth length or birth weight of children or some other parameters of children health. Also, there was no found some specific changes. So probably the influence may be, but to understand this influence need very big number of studies and very big number of case studies, because this influence for sure not very pronounced. And at the end, we will talk a little bit about embryo transfer, preparation of the endometrium, and natural cycle or replacement hormonal therapy cycle. Why it is important? We know that exist described a lot of different protocols of endometrium preparation. We can divide them in two types: pure hormonal replacement therapy and natural cycle, totally natural or natural, what we call modified cycle. It means that there is a little stimulation during this preparation, and during this stimulation, own hormones produced and preparing endometrium like that. So, what is the difference? The main difference is the probability of pregnancy and also probability of complications during this pregnancy. With natural cycle preparation, when woman has corpus luteum in their ovary, all parameters of success are higher. The difference is not very big, but anyway, biochemical pregnancy, clinical pregnancy rate, implantation rate, ongoing pregnancy rate, all these parameters are higher with natural cycle preparation. And complications with natural cycle are less often. For example, when we compare the probability of preeclampsia in egg donation program, it is around 13 till 18%. It's quite high. It's around every fifth pregnancy will be with such complication. And when we compare that with traditional IVF treatment, it is we can see that it is 3 times higher than in traditional IVF. And if we have twins with egg donation, the probability of preeclampsia is around 27%. It's a really huge number, because with preeclampsia, sometimes doctors need to stop pregnancy development. So it is important to know that with natural cycle preparation, if it is possible, if ovary is still working, it may improve the probability of successful pregnancy and successful delivery. Also, complications during pregnancy in case on advanced reproductive age also depends on age directly. It means that probability of all complications became much higher after 50 years old and especially after 55 years old. Um, I will change. So hypertension before the age of 50 years old is around 26%. It's high. But after 55 age, after 55 years old, it's around 60% or even more. Probably this is the reason why in most of countries the age limit for embryo transfer is around 52, 53 years old or even 50. Also, second complication, quite serious complication, is gestational diabetes, and also with advanced maternal age, it is maybe even around 20%. Some complications like placenta previa, preeclampsia, thrombosis, heart attack, cerebrovascular accidents, also 2-3 times higher with advanced maternal age and with artificial preparation protocol, replacement hormonal therapy preparation protocol. So in case on your ovary is still working, it will be better to do the natural cycle preparation protocol. So at the end, I would like to say that before embarking on egg donation or embryo donation program, it is important to know the protocol for selection and screening of egg and sperm donors, and also legislation restrictions, possible restrictions in country where you would like to do this program. Also, will be good to know the source of embryo. It is donor plus donor, donor plus patient, and like that you will have more deep or less deep profile of these donors and more or less information. Also, you need to check your own health carefully because some complications may be due to previous health problem and your age also. In case of diabetes, thrombosis, hypertension, hormonal disorders, infections, or other pre-existing problem, it is important to carry out tests and stabilize your health. Also, be aware that in some cases, obstetric risks can be unfortunately very high. And endometrial preparation protocol can influence the certain complications or just opposite to decrease the probability of some complications. So that's all for this evening. Thank you very much for your kind attention. And if you have some questions, I will be happy to answer all of them. Thank you.
Thank you so much. Thank you so much, Dr. Sterkel. As always, it's been very thorough, very interesting, and I'm glad that you are back. And it was very informative for sure. And now we will go to our questions.
Thank you.
And as you can see, some of the questions are ready. If you haven't asked yet, this is your time
Mhm.
to do it. Let's start with our Q&A session, and let's have a look. The first question we have is from Marie. Do we have any age restriction for female recipients?
Uh, Look, good question. It depends on country where you will do the transfer. In most of European country, the age restriction for female recipient is around 52, 53 years old. In some country, 50 years old. In some country, there is no exact restriction, but necessary to have kind of certificate and agreement that you are healthy and so on. So this question depends on country. In Ukraine, we
Okay.
have no the
Hmm.
restriction. It is not written that okay, after 55 we cannot, but after 52, 53, we ask in some additional medical certificates to understand
Hmm.
that
Okay. Yeah.
health is more or less okay.
Yeah, of course. Okay, that makes sense. Of course, again, thank you so much for adding the information about Ukraine. I was just about to ask you. Thank you so much indeed, Marie, and I believe that was helpful for you. Emmy, what are the next question is from Emmy? What are the pregnancy rates with embryo donation for women older, older women over 42?
Okay, look, the pregnancy rate, there is no a big difference in pregnancy rate in, for example, with embryo donation regarding the patient's age. It is rather the question of endometrium quality and endometrium receptivity. So, if we are calculating the probability of pregnancy rate, it is mostly the same at 40 years old and 45, and little bit less, more than 46, 47 years old, but mostly because on endometrium quality problems. Because the pregnancy rate related on age of woman more depends on egg quality. But if we are talking about embryo donation, egg quality should be good because it is those eggs.
Hmm. Okay, thank you. And one more question. So, are donated embryos genetically tested?
Depends. It may be genetically tested.
Hmm.
It may be not genetically tested. If it is what we call embryo adoption, it means that it was embryos of patients who has delivery yet one or two or three, and also they still has embryos, and it may be genetically tested but also maybe not. This question should be discussed with your doctor. If you are doing the egg donation program with sperm donation at the same time, you also may ask about genetic testing of your embryos. But from scientific point of view, if woman has less than 38 years old at the moment of pickup, and it is the case of egg donors, normally there is no big benefit of genetic testing of embryos.
Okay, thank you for the clarification. That again makes sense. Of course, thank you, Amy, for your follow-up question. Okay, let's have a look, Diana. I would like to know, so how necessary is to do HLA-seq receptor test for egg donation with husband sperm?
This is a very good question because around 10 years ago, or maybe less, maybe seven, it was really the explosion of these tests, and it was the publications say that okay, we resolve all problem of repeated implantation failures with that test. But last publications say that there is no enough information and not enough scientific data to prove that this test may be helpful. Uh, and in case of egg donation, as for me, this test has not a lot of interest because you can choose another donor. And in this case, expression of
Okay.
HLA receptors will be different. So,
Mm-hmm.
as
Okay.
for me, in case on egg donation, it is not very helpful.
Okay. Thank you for your question, Diana. And let us know if you, yeah, there's a thank you from Diana here for you. Okay, there are some parts of the question. So I will show you from here. So I'm 41, had 7 unsuccessful cycles, tested embryo, donor sperm and eggs, PGT tested. And if going for egg donation because implantation failure, what you can do to prepare for frozen transfer?
Look, in your case, it's quite a difficult case because several unsuccessful transfers. It may be beneficial to do the preparation in natural protocol. It means following your growing follicle, measuring it, and weighting the size of 18 millimeters and endometrium around 8, 7, or maybe 10 millimeters. Sometime, if endometrium not growing quickly, we can add some estrogens. And when follicle will has this size, around 18 millimeters, we will give triggering with HCG. And then from the next day, we start the progesterone, and like that, will prepare you to the transfer. When we have such protocols, such preparation protocols, the level of progesterones is around twice higher than in a replacement hormonal therapy cycle. And also corpus luteum produce substances named relaxins, which avoid intense contraction of endometrium, and also it may be helpful. Embryo will not be expulsing after the transfer, so it may be per se beneficial. Also, what may be interesting, try to do what we call double transfer. It means that you can have your implantation window a little bit later than normally, 6 day of progesterone. And it is written that implantation window in young age more often is more early if it is not in normal place, but in late reproductive age more often it is later, a little bit later. So you can try to do your transfer after 6 and after 8 day of progesterone also. What can be interesting also to see if you have, for example, chronic endometritis. There are some kind of genetic tests like EMMA, ERA tests, and they can show chronic endometritis and also implantation window, the exact measuring. From the other hand, the last publication about repeated implantation failure guideline 2022 say that implantation window is also not enough data. It's not very exact. In different cycle it may not be the same. So, okay, with scientific data, it is always like that. First 10 publication, wow, and then another 50 is in between, and after is not exact. So necessary 10 years probably to have some final information.
Yes, it's true, of course. Unfortunately, those takes this happens all the time, right? So when it comes
Yeah,
to
yeah, yeah.
medicine, so this is what we have at this point, at least, right? It may change, as you said, it may change. Thank you so much. If there are any follow ups, go ahead, type this in. Now we will go to the next question. Interesting question, possibly our final one. But of course, if you have more questions, you know what to do. Go ahead, type those in. The question is, so when patients don't want their embryos, what percentage discharge them or donate them? Are you able to tell us more or less at least?
Yeah, I can tell. I can tell. Most of patients are ready to donate embryos because after delivery of baby, from psychological point of view, they are not able to destroy their embryos. Uh, Maybe one half of them continue to cryo storage
Mm-hmm. Yeah.
because
Okay.
okay, even if they don't plan right now to have children, but they cannot how to say accept the idea that embryo may be destroyed.
Yes.
And around maybe 30% or 40 accept to give them for embryo donation.
That's a quite good number, I would say, right? So it's interesting. Thank you so much. Definitely interesting question. I'm not seeing any more questions, but of course, if you have more, you can ask them right now. There's still time. But if not, remember there is an option for you to get in touch with Dr. Strelko, and I've met Tib, and I'm sure they will be happy to answer more questions. And I'm sure they will also ask you for more details. Of course, as we know, you would need to provide more details to get a proper advice, to get a proper um, even maybe treatment plan, etc., etc. So someone is typing, so I want to make sure whether it's a question or a thank you. Let's give it a second. And we will be finishing. And actually, yes, we did receive one more question. So, what type of psychological therapy do you recommend for egg donation as a recipient? Yeah.
As a recipient.
Yes.
Okay, okay. We have some psychological support, but there is no the exact program of support because for some patients, the main problem is accept egg donation because how to say they afraid that they will not feel the connection with this baby and accept the idea of egg donation. This is the most difficult, so it is one type of work in psychological support. For another patient, it's raised the question if donors, how to say, will not search in their children. They are worried that for donor maybe some connection, some feeling for these future children, and this is another kind of worrying. For some patients, okay, they afraid to become pregnant generally in case on egg donation or without egg donation. So it depends on patient and depends on situation. For some
Mhm.
patients, very difficult to accept not successful treatment.
Of
If, for
course.
example, we has done the transfer and it is unsuccessful result, uh, for some patients it is very very painful, and also we asking our psychologists to support them. So
Yeah. Okay.
there is no the one
One
exact
protocol.
program
Mhm.
which will work in this case.
Yeah. It's always need to be individualized. Yeah. Because, of course,
Yeah,
every patient, every story is just different as well. Okay. Thank you. Thank
yeah.
you for your question. And one more here. Thank you for useful information. Maybe my question was not from you. For me. Okay, let's see. I had many transfers with my own embryos that failed to implant. Now I'm going for donated embryo. Can you suggest the preparation for donated embryo transfer?
um, Preparation from I mean gynecological point of view or psychological point of view, because there was some articles describing stress as a factor which can decrease the probability of successful implantation, because when you have high cortisol level, it may increase your prolactin level and decrease estrogens and normal functioning, for example, of corpus luteum. And there are some works describing that acute stress may decrease the probability of implantation or increase dramatically the probability of miscarriage. For example, during some military conflicts, as we have in Ukraine, unfortunately, we can constate that we have more complications during pregnancy, and at the beginning of conflict we has much more biochemical pregnancy. It means that positive test and then pregnancy does not developing, probably because on I don't know, people was not be able to find some medicine, or probably because of acute stress, but it may influence, unfortunately. So uh, there are different propositions for that. Some doctors propose yoga. Some doctors propose like reflexotherapy, like Chinese therapy, because during big congress there are the special sections of some herb therapy, Chinese therapy, some yoga, and so on. And the results, publishing results, are really interesting. So it depends on your preference and your possibility, but it may be really helpful. Also, interesting direction is gynecological massage. In Australia, it seems there was some kind of courses, and they study women to do some self massage, and also it may be relaxing, improve blood circulation, and improve the probability of implantation.
Okay, so there are some things you can still explore and try to perhaps increase your chances. So thank you a lot for that advice. I hope that was that was helpful. There's a comment. Let's have a look. So thank you so much for your patience. Real wish situation in Ukraine will stabilize for sure. All the
Thank you.
best.
Thank you.
Thank
Yeah.
you so
So,
much indeed as well for that comment. And let's have a look. Yeah, that looks like that was our final question. So everyone, thank you so much for joining, for your questions. As you can see, I couldn't agree more with this statement. Thank you. I'm glad that I could get more information about embryo donation. That is true. So
mhm.
thank you a lot for joining. And there are some thank yous coming up your way, as always, Dr. Helena. So before we finish, I would like to ask you if there's anything else you would like to add, as always, of course.
Um, Probably we discuss all, but this topic is quite interesting, and I think
Truly,
if we will discuss this in 3 4 months once more, I'm sure that I will be able to find something interesting about that. So, if there are
true,
some questions, I will be happy to answer.
of
You can
course.
write this question directly to me.
Definitely. Thank you so much. Remember, if you wish to get some more details, you know what to do as well. You can get in touch with Dr. Strelka and her team at IVEMED. Thank you so much for this informative session. Indeed, Dr. Halina, it was great to see you back here. We will be back with some more events, so stay tuned. If you haven't registered for our next webinar, go ahead, go to our website, My IVF There are some more events coming up. Dr. Strelko will be back shortly. So stay tuned as well. And this has been recorded. So if you missed any parts, you will be able to rewatch this. It will be available on our website and YouTube channel tomorrow. I can only encourage you to subscribe. That way you will be notified when the video is actually uploaded. Thank you so much for tonight. Dr. Strelko, have a lovely evening, everyone. Thank you for joining. Stay safe as always. And of course, take care and hopefully
Thank you.
see you as well. Thank
Thank you.
you.
Thank you. See you.
Take
Bye
care.
bye. See you
Bye.
soon.